Coronavirus cases, as we've mentioned, now confirmed in all 50 states. Obviously, hospitals are getting geared up and waiting for the flood of patients that they are now anticipating at this point. GIanrico Farrugia, the doctor, is also the president and CEO of the Mayo Clinic. He joins us right now from Rochester, Minnesota. And Dr. Farrugia, thank you for being with us today.
Good morning. Thanks for having me.
So how are things going at the Mayo Clinic? What are you seeing at this point, and how prepared are you?
We, like any other healthcare system, every day that goes by, the more prepared we are. And I think that's an important point to emphasize, that for a lot of hospitals, including Mayo Clinic, we've gone through this before. We had to get ready for Ebola, for MERS, for SARS, for all the pandemics that happen every year with influenza. So we're ready. We also have a degree of cooperativity between healthcare systems that is actually pretty impressive. And we have great lines of communication with local and federal and state agencies. But of course, there are limits. And those limits are in people, in space, and in technology. People, healthcare, making sure healthcare employees are there and are able to work. Space, the hospital beds. And then technology, the protective equipment, as well as the ventilators and other things that are needed. And those tend to be fairly hard limits. But yes, every day that goes by, the more prepared we are. And at this point, we're prepared.
Of those limits, which one is your biggest concern?
So I didn't mention testing. That is a limit. It's a limit that is being changed daily. It all depends on how serious the population takes social distancing. And social distancing, and I heard you speak, and you and your colleagues are doing a great job, thank you, of setting an example. But that is what will determine how many hospital beds we need, and then about a tenth of them are ICU beds. And those tend to be ones that, yes, we can make more. We have ways of increasing hospital capacity, but that's a limit that is pretty hard to exponentially increase.
The ventilator situation is one that we've been watching very closely, too. You hear state governors now talking about their concerns about it because they're trying to find them. Federal government's trying to find them. What can you tell us on that front?
First of all, there's a significant supply of ventilators. They may not always be in the right place, but it is not as if there hasn't been attention given to the ventilator situation. We know that the more people get the virus, then a certain percentage of them will need to be ventilated. So it's very hard to create a model that allows you to predict how many ventilators we need. What we know for sure is that the less cases we have in the United States, the less ventilators we're going to need. And if we can space that over time, then I do think we would have enough ventilators. So it's really a question of everybody doing their part to make sure that we don't have a narrow peak. And everybody's now become very familiar with the term flattening the curve, which has entered everybody's lexicon.
Doctor, though, in terms of those ventilators, you look at the hot spots, both in Seattle. Some of the anecdotal stories in Seattle are relatively horrific, and then you look at what exponentially should happen in New York. Do you try to therefore move the ventilators around the country, to try to meet the demand? Is that what's happening here? Because you're not hearing anything about that. Meaning, would you front load those ventilators to New York now, ahead of this, with the anticipation that you would move them, dare I say, to Chicago or someplace else later?
Who's giving up their ventilators right now, though?
So it's a very reasonable point, but we have to keep in mind that we have to plan for what's going to happen tomorrow and next week, not what's happened yesterday. And so you don't want to be chasing yourself. So we have to make sure our supply of ventilators is well distributed throughout our system. And yes, there are times when things can be moved about, but we have to stay away from the impression that we can sort of chase this. We need to be prepared as a nation, because it's going to be required for us to be prepared as a nation. And that's what Mayo Clinic is doing. It's preparing at all our 3 sites in Arizona, in Florida, and of course in Minnesota. And I know our colleagues across the country are doing the same thing.
Dr. Farrugia, I want to thank you for your time, and we hope to check in with you again in the days and weeks to come. We appreciate it.
Well, thank you. And I just want to make sure I thank all the healthcare workers especially the people that are cleaning the rooms, looking after patients, as well as people that are creating the supply that we need. So thank you very much.